payroll. Thank you for voting us Yuba Sutter's best in multiple categories, including financial advisor and wealth management firm for the past 5 years. You can find more information at shawassociatesinc.com or 530-674-1150. Shaw & Associates is proud to support community radio.
And Captain,
Yeah.
we've got somebody in here that's he's been a pleasure to talk to who's been in here. Chris Champlain.
Yeah.
Did I say that right this time?
You did. Good morning.
Yeah, good morning. Adventist Health and Rideout.
Yep.
You're
Is it
president.
Adventist Health and Rideout or Adventist Health Rideout?
It's Adventist Health and Rideout.
It is and Rideout.
And
you
Rideout.
You got it right.
Sorry.
You don't need to apologize.
Okay.
There's no reason to.
Because I look at you sometimes and you're going, did I say that right?
Well, it's always kind of confusing how to say things and what you say. So, but let's get to know about you, how you got into the medical field, because you're not a doctor.
I'm not a doctor. No.
Thank goodness. Oh.
Oh no. We love doctors.
Yes.
Guys.
No, I mean,
Yeah.
Dr. Bambostic Bushkin, I'll practice on you right now.
No. Actually, I was going to be a doctor. At least I thought I was going to be a doctor when I was a kid. I grew up and I thought, well, I'm colorblind.
Okay.
And this is how much I knew as a kid. I was going to become an eye doctor and cure colorblindness. Little did I know that it was neurological, right? But that was what I was going to do. So got to college and thought, well, I got there. I'm like, I don't know. I don't know if I'm a good enough student, and I don't know if my heart's really in it. Met my wife, who's a nurse, and we were sitting down one day, and she said, I don't know if I want to be married to a doctor. And so I said, well, good, because I don't know if I want to go to med school. I took a side trip. I was taking a class in public health at university and ended up loving it.
Yeah.
Just loved it. And this is like the mid-1980s. So got into public health. And this is when the world was just learning about AIDS. And so I did an AIDS education and prevention program. This is down in Southern California that eventually moved up to San Joaquin County, Stockton, and was there and did Prop 99 tobacco and all kinds of things. And here I am, I won't say the number, but quite a few years later. Been in healthcare for, I guess I will say it, almost 40 years.
Wow.
Oh, wow.
And here we are. So, yeah.
So what is it about the healthcare industry that's like kept you locked in and just saying,
goodness.
I'm just going to do healthcare?
Oh my goodness. So I think as I age, and I probably shouldn't say that, but my goal in life is to leave the world a little bit better than what I came. And maybe that's just something that happens as you sort of mature. And healthcare is that, when you find a career where the goals of the career match your personal aspirations, it's home, right? You don't want to go anywhere else, right?
It becomes fun because
fun,
it's a hobby type thing. It's not a need to, it's a want to.
Yeah. Yesterday I got the opportunity to go out with Cindy Cooper. I mean, you've heard about our street nursing program.
Yeah.
And, spent the afternoon with her, doing the street nursing and helping people. And I came home and I was like, I'm inspired, right? This is what we live for. Right? This is what we do. And the team here at Adventist and Rideout is just amazing when it comes to that heart, right? That heart for the community, that spirit of service. Love it.
And you've been with us now for how long?
13 weeks. Yeah.
Wow. So
I'm
you're
the new guy.
You're a newbie. Yeah.
I'm the new guy.
Yeah.
Right.
How many nougats have you gotten so far? Being the new guy.
Fortunately, none. The title of president sort of you don't get noogied that often.
It comes with some clout, huh?
I'm sure there's people who want to.
Yeah. So with the whole COVID situation and people not able to work in this and that, you don't want to do that because you want to keep your job.
Right.
Yeah, definitely. So where did you grow up? How'd you, and get to Yuba City?
Yeah, so I grew up in Massachusetts. I'm a Boston boy.
So, but you don't have the accent.
Yeah, it's there sometimes.
Unless you're asking for cod.
Unless you're asking for cod. Yeah, codfish.
Oh, there you go. There it comes out.
Yeah.
Got it.
Or dater. What's the other one? I can't say the word mirror, the thing you look in.
Mirror.
It's a mirror.
Mirror.
Mirror, yeah, and a draw. I think
you guys do a lot of the eh?
Yeah. So anyway, my wife gives me grief from time to time. But yeah, so came to California, went to go to college, met my wife. She's from Hawaii, born and raised.
Wow.
Island girl. California was sort of midway, so we stayed here, raised our family. Came up to the Sacramento market when I was with Dignity Health about 7 years ago, and then 13 weeks ago made the jump from Dignity Health to Adventist Health, and here we are. Just bought a home in Yuba City.
Nice.
I see, she's going to remodel it, so I say I'm in the check writing phase right now. But
Wow.
haven't moved into it yet. But, yeah.
Is it a big fixer-upper, or is it just a minor fixer-upper?
It depends on who you ask.
Yeah.
For me, I'd live in it right now.
Sure.
But your wife's got to have it.
Yeah, about 12 years ago, my wife and I took a little trip to Reno and stayed at the Pepper Mill, and then coming home cost me about $2,500 on a bathroom remodel. So now when we go out of town, we stay at Motel 6.
Yeah, right. Suddenly you're the queen. Yeah.
Yeah. So how do you find the Yuba Sutter area? Just moving in, just being kind of fresh in the area.
We love it. I said I grew up in Massachusetts, and I was in an area like this, a lot of farming. And so for me, it's home. I just love it. Everybody's been so welcoming. I can't say enough about the welcome that we've received. Everybody's
that's great.
you get in the city, right? And you see people and you know them. You kind of know them, but you don't really know them. And everybody here has just been so genuine and brought us in. And I feel like I've got a brand new set of friends, and it's
Nice.
great.
Yeah.
And who can turn down a community that has its own mountain range? I mean, come on, right?
Not only its own mountain range, the smallest mountain range in
the world, right? I heard
Yeah.
that.
Well, of course, you've heard that in Oroville, they have Tabletop Mountain.
I didn't know
Well,
that.
Paul Bunyan supposedly cut the top of that off. It's now the Buttes.
Oh. Okay, now I know the story.
Yeah, now you're getting all the Northern California folklore
So
going
now
on.
that you've heard that, you can use it.
I will use it.
I heard about that. Yeah.
Yeah.
So going back to your job now,
Okay.
let's focus on what you do. What's happening with Adventist Health and Rideout, and what's going on there? And
Yeah, we've got a lot going on. I got to tell you that the staff over there have been amazing. We had the last peak of COVID a couple of weeks ago. An average day in the emergency department at Adventist Health and Rideout is about 180 patients.
oh
right?
wow,
A couple of weeks ago, 320 patients a day going through that emergency department.
oh wow,
And here's the cool part, right? So the door to provider time was 11 minutes.
Wow.
Nice.
That is amazing.
That's phenomenal.
yeah,
right?
that is
Yeah.
amazing.
So the people were getting in, they're seeing a provider right away. It was truly amazing. Team did a great job.
That's awesome. Yeah, because, I've heard of stories where people having to, even being out in the hallway in ER list, waiting for a bed to be seen,
Yeah. Now-
3 years ago even.
Now, getting into a bed's a little bit different story, and
Right.
this is something that I think is really important that we're going to focus on this year, which is growth and partnership. So, if you think of the hospital as a bread box, a giant bread box, right? Because right now, and mainly because of COVID, there are no skilled nursing beds. There's no subacute beds, and so when the person is ready to discharge from the hospital, lots of times there's no place to go, right? So that bread box, you keep putting bread in, but you're not taking bread out, and so you're getting very, very full.
Right.
So at times, there's a long wait to get a bed, but you're seeing your doctor within 11 minutes or your provider within 11 minutes. So we've got to start developing those relationships, right? We're out in the community and start developing the infrastructure that we need so that we can move patients through the entire spectrum of care. So you get in, you use the hospital for what it needs, but then you go to the appropriate level of care after that. Yeah.
Right. So what are the goals? How are you going to accomplish these types of things? So
So I've got 4 big goals for the year. And I thought, well, there's probably a bunch we could choose from.
Right.
But that would be like boiling the ocean, and we probably wouldn't get anywhere. So 4 things to do. So quality, I believe that quality is our product, right? You've got to have the highest quality of care anywhere in the entire state. There's no reason why we have to be second to anybody. So we're focused on care. Amanda and Cindy and the team, are really focused on making sure our quality is up there. Every single morning, we have a quality huddle. We go through, we make sure we're doing everything right. Second big thing is experience. And, I think experience has to match that top quality care. And if you'll humor me, I'll tell a quick story. And kind of
definitely.
What
Go
got me
for
there.
it.
So my daughter was in college. She was down in Southern California, and she had an issue, and she got raced to this large medical center in Southern California. My wife and I get the call. We jump on a plane, fly down to Southern California, and we go into this massive building. There are 9 ambulances waiting in the ambulance bay. There's a helicopter on the helicopter pad. There's a helicopter circling, and there's another one farther out. They'd had this big gangland shooting, right? Mm. So this situation that we're walking into is a zoo, right? And we're thinking, how are we gonna find our daughter? So the lady in the front of the emergency department takes our names. Oh, Mr. and Mrs. Champlain, we know exactly where your daughter is, and takes us back immediately. And I thought, how do they even know where she was? But that lady knew. It was like her job to know where every patient was. And that was impressive. Got more impressive as we went. So my daughter's crammed in this bay made for one person with 2 other people, so 3 women.
Okay.
The EVS worker, the housekeeper, comes by, and she strikes up a conversation. Now, in most hospitals, the EVS workers really put upon to make sure that everything is clean. But she starts talking about music. Then she looks at my daughter and she says, "Sweetie, your lips look a little bit dry. Are you thirsty?" And I'm like, the housekeeper is asking my daughter if she's thirsty? My daughter says, yeah. The housekeeper picked up the phone and called the doctor and said, "Hey, I've got a patient here that looks thirsty. Can I give her something to drink?" And the doctor said yes. I was like, wow, everybody in that hospital, every employee was empowered to make a difference in every patient's life.
Wow.
And at that point in time, I vowed that will be the kind of hospitals that I run. So it's really, really important to me. Third thing is length of stay. We've got to get patients through. We've got a lot of long visitors with us. And the last thing is growth. We got to focus on growth. We need primary care in the market. We want to establish primary care offices throughout the entire geography. High visibility, easy access, extended hours, Saturday, Sunday hours, so that you're taking the kids to school in the morning and the kid's not feeling well, you can pop in, see your doctor, not an urgent care, right?
Right.
But your doctor who knows you, who's been caring for you for years.
Right.
That sort of thing. So those are the 4 things I'm focusing on.
So what are the things, you've got those goals, what have you set up to try to accomplish those goals for, like the care you're talking about with your daughter and how that hospital just made that care and made that all work, and talking about growth. And so how are you going to accomplish that?
Yeah. So the experience, and I love doing this, we are doing executive rounding every day. So rather than sitting in my office, I actually get out, the entire executive team gets out, and we go and we visit patients between 9:15 and 10 o'clock every morning. We call it our golden hour.
Okay.
And we just walk around, we talk to patients, we pop in. I always ask them how they're doing, how their care has been. It's an opportunity to brag about the staff. I was up on 4 Main yesterday, and the nurse, Alyssa, was taking care of one of the patients. And she was just, she's a really, really good new nurse. And I thought, you're in the best hands possible here. And then the patient just lit up, and we sat and we talked about her life. Had another guy I got to talk to who was an SR-72 piloter on the team. We just talked, for half an hour. So executive rounding, the entire team is in there. Then we come back, we huddle, we take the learnings from that time, and we put them into, say, if food was cold, so we work on that. That's just an example.
Right.
Yeah.
But it's hands-on.
Hands-on, and it's time, right?
Right.
There's no better way to have a good experience than to spend time with somebody. And that's really what we're doing for that one.
Yeah. So I was in the ICU about 3 years ago. I had a crushing injury on my right hand that still affects, right? But I was in there for a few days. One of those things that was kind of crazy is how confusing that hospital floor plan is and walking around. How have you adjusted to that? Because that hospital floor plan, I tell you what, you're talking about walking around and visiting people. Do you ever get lost?
I wish I could say that I didn't, but I'm still learning my way around. We've got 3 main, we've got 3 west, we've got 3 east, and they're in 3 different towers. And so it's like, okay, wait a minute, what tower is 3 main in? So, my team is great. They're like, hey, Chris, go over there. That's the elevator you want over there. But eventually you'll learn it. You're there long enough, I'll learn it, I'm sure.
Gotcha.
It's really cool every once in a while to have the windows open in the summertime and see a helicopter come in and land on the helipad up there. It's like, wow, that's, and I attend church with a helicopter.
Do you?
The red ones.
Yeah. Life Alert.
Life Alert. And it's interesting, he said.
Yeah. But, it gives me chills. I drive in the morning and sometimes there's a helicopter up there and I'm like, we're saving a life right now, right? And earlier you asked, right? What keeps you? That keeps you, that connection to humanity.
Yeah.
That's a good point. Connection to humanity, connecting to people. And healthcare is one of those things where it can either turn you way off or turn you way on, just the way your care is taken care of. So as your healthcare is going through and you're getting that care for those people in the hospital, what about the post-care and things happening afterwards? And how are you keeping the patients so that they're actually getting the right care even after their hospital stay?
Thank you for asking that question. Almost no one asked that question. I think it's a really important one. We've got a new program that we're trying to roll out. It's called Care Connect. So if you come through our emergency department or before you're discharged, we're making sure that you've got a follow-up visit already scheduled with one of our providers. Hopefully it's one of our providers. If it's your own, then that's great.
Right.
If you don't have a provider, then we're making sure that you get connected with it.
Yeah.
That post follow-up care, that's the most important part. It prevents the readmission. You don't want to just keep showing up, right? So, that's our Care Connect program.
Right.
All right.
And you guys have connected through the community and connected with trying to help care for the homeless population and going out on the street, actually, and doing street contacting and caring for those. What have you seen? What are the benefits from doing that in your perspective?
Well, let me just talk about that for a minute. So yesterday I had the opportunity to go out with Cindy Coop, who's our street nurse, and it was inspiring, to see her. She knows that community, right? Mm-hmm. She knows the people in the community by name. She knows where they are. Spent, quite a bit of time driving to where people in our homeless community are, checking blood pressure, checking O2 sat, checking medicine, are their medications being refilled, making sure that they had their medications, popping by the pharmacy, picking up the meds, bringing them back to them. To me, that is just, that's healthcare at the core.
Right? Front line.
Right.
That's where you want to be. So that is a special program, and the team that runs that, Ashton and her team, they are just the most special people. Yeah, it's amazing.
Yeah, you know what I've pulled from this interview. Our time's almost up, but what I've pulled from this interview, Chris, is you love who you're working with.
I do. Yeah.
And you love how they're handling the situations and the problems that come up, and the solutions. And you being the president of Adventist Health and Rideout, and seeing that, are all the solutions just coming from your team, or are you hearing from also those that are working in the hospital, those that are working in the healthcare field, to try to create those solutions?
Oh, no. It takes a village, right? It does. And really, it takes a village beyond just healthcare, right? I mean, I'm working with the mayor here in Marysville, Chris, looking at how do we develop housing, how do we develop a healthy community. Our Blue Zones project, Steve Krager and his team are trying to improve.
They're fired up too, man.
Oh, aren't they cool?
They're great.
They're so cool. I like those guys. And then outside, the building industry, the political industry, and then the beauty of Adventist Health and Rideout is we're part of Adventist Health. right? So we've got Roseville, we've got 23 hospitals around in the system where we can pull best practices from. So as much as we would like to say that we're brilliant, we've got a few ideas of our own, but it's nice to have a bigger family to pull from.
Yeah.
Oh, that's great. Steve, is there anything else you'd like to say before we finish this interview?
Thank you for having me, first of all.
Thank you for coming in.
Yeah.
Thank you for the
Awesome.
welcome, and hopefully we can do it again.
Sure.
It's great to meet you.
Yeah.
Pleasure was mine.
Welcome to Yuba City,
Thank you.
Marysville.
Yeah, thanks.
This community interview is made possible by Shaw and Associates.
I'm Dave Shaw, President and CEO of Shaw & Associates. For over 65 years, Shaw & Associates has been your trusted local expert for wealth management, tax, accounting, and payroll. Thank you for voting us Yuba Sutter's best in multiple categories, including financial advisor and wealth management firm for the past 5 years. You can find more information at shawassociatesinc.com or 530-674-1150. Shaw & Associates is proud to support community